VCOM-Auburn, Beyond the White Coat, where we explore the multifaceted world of healthcare and medical education. Every episode, we will bring you insight conversations with experts, VCOM-Auburn students, and healthcare professionals, revealing their unique experiences and perspectives. Get ready to delve into groundbreaking research, innovative treatments, and personal stories that will shape the future of medicine. Let's go beyond the white coat to uncover the human side of healthcare. Hello, everyone, and welcome back to another episode of VCOM-Auburn, Beyond the White Coat. I'm your host, Brittany Lilla, and we're excited to have multiple guests joining us today. Today's episode, we will be discussing an important topic, disparities in Hispanic and Latino health. We have a few second-year VCOM medical students as well as 2 doctors on today's episode. So let's dive into the conversation.
Hello, everyone. And if you guys want to kind of introduce yourselves, Sabrina.
Hi, everyone. My name is Sabrina. I was born and raised in Puerto Rico, and now I'm here in Auburn, Alabama, doing my second year at VCOM.
Hello, everybody. My name is Millie Walker, Milagros. Okay. I was born in Peru, but I've been in America for the past 20 years, and I am a second year of medical student at VCOM, and I'm happy to be here.
My name is Carlos. I was born in Miami, Florida. My parents are immigrated to the U.S. My dad's from Colombia, and my mom's from Panama. And I am a second year here at VCOM-Auburn.
Very cool.
I'm Dr. Sarah Watts from Auburn University College of Nursing, and I work very closely with the local Hispanic community to do outreach and also working with Dr. Rodriguez and others to really develop the research for, interventions to improve health for Hispanic men and women.
Hi, my name is Dr. Mayra Rodriguez. I'm Discipline Chair for Preventive Medicine here at Auburn. I am a first-generation Mexican-American, and I'm just so excited to have this conversation today. I think we'll just get started. The first question I have for the group is, what are the most significant health disparities that you believe that the Hispanic Latino community is facing today? Millie?
Well, first of all, I think coming from my personal background as an immigrant, first of all, is adjusting to the culture and adjusting to the language. I think that's one of the major disparities that we're facing. I did not speak English when I came to America. My husband actually is the one who helped me how to build my vocabulary in English. But it took us in the area where I live, which is in Mississippi, Gulf Coast, Gulfport. There weren't really many Hispanic doctors. They were a little bit, I don't know if they were ashamed or a little bit kind of reluctant to speak in Spanish. So I was kind of like, I didn't know what to face or how to handle that. I think, and sharing that type of situation happened to me when I used to volunteer at the St. Vincent de Paul Society here. I encountered several other Hispanics that felt the same way. They did not speak the language. They said, how do we get to the doctor? We cannot even get to the front desk person and just to get an appointment. Other thing would be the access to insurance. When I came right away, I wasn't insured. So it took us a little while just to get there. My husband was just starting his career. So it was a lot of take in. So if I would have to point a couple of things, will be the language disparity and the access to insurance.
Absolutely. Yeah, I completely agree with that. Does anyone else have anything else to add?
I do. So great point that Millie brought up with health insurance, and that brings us to preventative care. We know that if a patient doesn't have health insurance to start with, they're much less likely to go to their regular every 6-month appointment to their doctor, and therefore they're more likely to have all these diseases and not be able to know them or take care of them. So I think that's also a major one, preventative care. I come from a background where there's a lot of smoking. Smoking is like a social kind of event thing that happens, right? With smoking, and we know that with smoking comes lung cancer and all of this other not great stuff. And perhaps that could be avoided if only you had some preventative care, some every 6-month appointment of hey, quick reminder, don't smoke. Because then it also comes secondhand smoking and all of these other issues that come with it. So that's maybe more like specific coming from preventative care and smoking.
That's really good. Yeah, I couldn't agree more. In terms of conditions, we think about, well, Hispanics in general they actually have a longer life expectancy compared to other groups. And you might say, well, this is fantastic. This is great. We don't have anything to worry about. But that's at the surface level. What we see with our population is that there is the comorbidities. And so they suffer.
Yeah.
And that's not a good thing. We know as healthcare providers, Dr. Watts, you see that firsthand where now the system is impacted heavily, right? Because people are sick and they're sick for a long period of time. Anybody else want to chime in about anything else? If not, we'll move on to the next question. Dr. Carlos?
I can chime in. I think from the moment I was born and growing up in my family, the one thing they always mentioned to me was our family history. And you can probably agree with this as well, being from a Latin American background, that any sort of cardiovascular risk factor in your family history, I don't know what it is. I think it's what Serena was saying about the use of tobacco and the years and years of using it, and as well as just family history. High blood pressure, it runs in, I would say, most Latin American families, as well as high cholesterol. That's just something I noticed. And these populations, especially when they come to the US, they understand that they have that family history. And I think it's, they need to know how to accept it, know how to prevent to prevent something bad that could happen to them, for example, such as like an MI or any sort of CV event. I think it's a disparity of the fact of, in terms of education and sort of counseling within that, when it comes to a doctor seeing a Hispanic or a Latin person in their clinic, they need to understand the importance of their family history. They don't know their relatives, but it's important for Hispanics to be open with their doctor, be open about that, and just be upfront, because then, within that, you're saving your children. And that's just important to me.
You spoke about hypertension, and what would you say were the 3 top chronic diseases that the Latin community faces? The top 3. Definitely hypertension is one of them. What are the other?
For sure, diabetes.
Absolutely, Dr. Watts. Yes, diabetes, and of course, obesity, not a disease, but that comorbidity that definitely leads to the heart disease and all the other conditions.
And I wanted to chime in now that we've taken block 4, which is cardiovascular pulm. I think we can all agree that the importance of treating a cardiovascular disease goes beyond like the symptoms and just fixing them, because a cardiovascular disease won't be fixed in a month or 2 months. It takes time for the medications to work. It takes lifestyle modifications for the disease to lessen or the symptoms to at least go away. But once the damage is done, the damage will be there. It's not reversible. And so when you have our Hispanic Latin communities out there who are just like smoking or not taking care of themselves, or the lifestyle that they take in wherever they emigrated from versus the one here, it's very different. It's a stress, and it's really hard for them to treat that disease because, again, it takes time and effort, and some of them just don't have the means to get health insurance to get the help they need.
Absolutely. Touching on that leads very well into the social determinants, right? You identify, how do you know all about the social determinants at this point? These conditions, right, that we live in, whether it be income, education, housing. How does that impact the health outcomes of our population? Dr. Watts, you want to take that?
Yeah, I'll be glad to. So I work, like I said, with the Hispanic community locally, and many of the families live together in a trailer or a mobile home and a small home, and there could easily be 15 to 20 people living there, supporting each other. And a lot of times they're not in great conditions. There's mold and a lot of other issues, lack of heat. And so you can imagine the impact that has on health. We do have a great educational system here in this part of the state, which is wonderful. And so for many of the families, that have come to this area. They're very grateful to have great experiences for their kids in our system. But so that's definitely a positive for this area. Income is a struggle. So, for many of the families, they can't afford to go to see a doctor or a nurse practitioner to improve their health because they don't have the money. There are not any physicians, our nurse practitioners in the area are not many that will see patients that do not have insurance. And so that plays a big part. We kind of talked, these three brilliant students talked about that with the first kind of point was, the lack of access to care, language barrier, all those things. So, all the social determinants have helped, with the Hispanic community. Like we said, talked about income, education, housing really do impact their health outcomes. Anybody else have any thoughts on that?
Yeah, I absolutely agree. Go ahead, Melly.
Just to add something on, and that was several years ago, of course, but when I didn't have any insurance at the time, just to see a doctor, the fees were outrageous. I almost say, how much? $300, $250. And I kind of laughed. I thought he was kidding, but no, he wasn't kidding. He was true. So wow. Well, at that time, he was able to cover it because, just Katrina just happened. And he just lost his job. So that's the reason why I did not have my insurance right away. So it was everything. And it was very difficult. But I can imagine many of our Hispanic population going through the same situation. They basically, many of them just depend on what they can catch a daily job so they can do. And sometimes it's enough just to cover for food and housing, but what about health? And let's be honest, as Hispanic, we like to eat good, right? We like to eat fried things. That's the reason why we have a lot of coronary artery diseases, as Sabrina was mentioning very well in there.
No, that's, yeah, go ahead, Sabrina.
I just wanted to touch on, for me, I think out of the multiple social health determinants, I think education is perhaps the number one fact. And I'm talking beyond just a degree. It's the fact that when a person has education and they have questions about a vaccine or they have questions about a certain medication, they know that they can open up a right resource and get the right information so they can make the decision that best accommodates for them. A very hot topic amongst the Hispanic population was the COVID-19 vaccine. And I was an undergrad here and we were doing some research in the rural communities around Tampa, Florida. And so that's Lakeland and kind of that area, trying to understand why they weren't getting the vaccines. We knew they weren't getting the vaccines, but there was a gap as to why are they not getting them. Some of them mentioned the moms were the ones that went, not really the dads, which is also a cultural factor. The women are usually the ones who take care of everybody in the family, even the husband. But one of the reasons was, the information that is giving to me, I just don't understand. And so sometimes the pamphlet was translated from English to Spanish, but you can't use the same terminology that you use in English because it's kind of complicated in Spanish. So whenever I try to translate a medical paper to a patient, I really try to use everyday verbiage that they use. They also felt like they were scared from immigration policy. Some of them were didn't have papers undocumented, so they were scared that the government would track them down with the COVID-19 vaccine and take them home and take them back to their countries and such. So this just really opened my eyes into understanding the needs of our community, especially rural Hispanic communities. There's a difference between urban communities of Hispanics and rural, and we really need help in the rural ones with education.
Absolutely.
Carlos, do you have any thoughts?
Yeah, so I was thinking about this as y'all were talking. So when it comes to treating, let's say, it's hard to see, as Millie was saying, when it comes to it costs a lot of money. Let's say you don't have insurance or you have an insurance that doesn't cover enough. You go and you do that one visit to a doctor and you do it with your whole family. Your whole family is there because it's the one time you can go to the doctor. And if it's going to be that much money or the insurance won't cover enough of it, it's going to be really hard to follow up. So, for example, a condition like high blood pressure, you cannot treat that acutely. You cannot. And the first line medications for high blood pressure, they come with big things of side effects, especially renal related follow-up is very important for those medications. So therefore, at that point, it's very hard to control it. And all you can recommend to them is lifestyle changes and education. And so and they might be looking for medication, but if there's a scenario where my patient, I can't have them, or they're struggling to come and follow up, I can't prescribe that medication to them. So I think that's a little bit of a hesitancy when it comes to treating these populations. And that's why education is very important, as well as improving access to care. For example, we have free clinics happening, mobile clinics happening for these populations, and going to those areas and providing that. And that's something that VCOM-Auburn loves to participate in when it comes to the city of Auburn and Opelika.
That's great.
That's really good.
That's wonderful. I'm gonna move on. This is a great segue to the next question. Thanks for your responses. What does language and cultural competency play? Sorry, what role does a language and cultural competency play in addressing healthcare disparities for Hispanic Latino patients?
So first of all, I don't know, I would like to intervene in that one. Sometimes some physicians, and I'm not blaming everybody, but just sometimes the ones I encounter, I have some experiences. Some of them kind of like feel judgmental, like they don't feel like talking to you much because they're scared of saying the thing that you will not understand. And then they try to get the translator, and it's a problem. Sometimes that translator is not there. So sometimes they try to maybe push you to the extenders like a PA or nurse practitioner that may have more time for you. And at times, as a patient, I feel okay. I believe that they are very, very competent providers, but what the doctor couldn't spend the same amount of time that a PA or the nurse practitioner, which were really good too, with me.
Yeah, I'll give my two thoughts about this. I think regarding from the healthcare professional point of view, there's this understanding that now at this day and age, the last maybe 10 years, this has become much more of a talk and an open conversation with healthcare professionals at the conference level, at the policy level, to where let's now do something about it, as opposed to, well, it's a problem, we kind of don't know how to address it or fix it. Public health professionals have been talking about this for a long time, but now it's essentially getting at, the American Medical Association. It's at that level where there's a devoted staff or devoted effort to try to tackle that some cultural competency, but it's hard. It's an enormous undertaking. It's not going to happen overnight to try to gain that cultural competence from, physicians that have been out of training, essentially, right, out of school for years and years and years. And it's so the way it's being tackled is, the people that are in the front lines right now, right, on the job training, right, or continuing education, but also with our upcoming, right, physicians in training right now. And so the idea is to try to tackle this from both fronts and try to address it. But even then, it's a significant undertaking. And with that said, I think it's a good thing that we're addressing it. We're trying to do something about it. It doesn't mean that, is it going to be hard? Yes. And we see how difficult it is, because whether or not we have a population that's, when you think about the environments, right, it's a busy clinic, it's a busy hospital setting, all of these things, and we have to think about cultural competency and how well, physicians can think about, well, been working for me so far, what else do I have to do? And shifting the ways of thinking can be difficult, right? Change can be difficult. So it's an upstream, but I think I'm positive to say that things are happening and people are acknowledging this, that it's a valuable thing, because we know that when we have culturally competent care, we know that we can, it's an upstream approach, right? In the long run, we can make an impact to reduce health disparities.
I'd like to ask a question. It's something you talked about, cultural competency, but I also wanted to go back to the language barrier. Dr. Rodriguez, I am not Hispanic, and so it's interesting in working with Dr. Rodriguez and others. I did not understand, like, as a healthcare providers, we don't have enough translators. We do often use family members to translate. in high stress situations or even low stress situations in healthcare. And I guess it wasn't until in the last couple of years I really realized what the impact that has. It's not good practice because that person is not trained to relay this information. It's against the law, most importantly, but also it puts often stress on young children who are having to translate. So I'd love to hear you guys talk more about how this practice, which is not great, of utilizing family members to translate, how it impacts family and the family dynamic.
Yeah. Carlos?
I mean, there's scenarios that I've had when I was working as a medical assistant, let's say, and there's a family and the parents, they came to this country to have a better life for their children. So the children's are over here, had some Spanish a little bit growing up, and maybe the oldest knows a little bit better English, but most of the family is just starting to learn English. But let's say the mother or the father doesn't know any English. So therefore, we're having to rely on, hopefully last resort, we have to rely on the family member in order to help translate. But that's why it's important for health professionals to learn this, how important this language is in the United States. Medical Spanish, it should be a part of continuing medical training. Right, CME, so continuing medical education. I don't know how often CME is because I'm still in medical school. I'm still in the medical education aspect. I think it should be added because to communicate something, and especially in layman terms, that should be easier than to learn a medical term. We're not as physicians, we're not communicating in Spanish with other physicians. We're in the United States, but we're communicating with our patients, and learning our patients' language will be much easier. So I think there's a lot, pressure to that language because we know all these medical terms and we know medicine in these terms. But it's important to just use a language, you would break it down to a normal patient English and just try to learn little by little as you do in Spanish. So I think it's very, very important to incorporate CME and as well as just hire more interpreters. Interpreters were a big help when we did our international outreach trips, which are still underway. We've done 2 so far. We've with VCOM. So one of the Dominican Republic, which Sabrina had the opportunity to go to in this summer, and then I just came back last week from Honduras, from Tegucigalpa, and we had so many interpreters that were just current university students or current medical students in Honduras, so it were a big help. I was lucky.
Awesome.
I was able to translate for myself and able to communicate with my patient. But for everyone else, it was much slower because they were having to communicate through an interpreter. But having that there made a big difference when it came to taking a history.
I also, when you're done, I just wanted to chime in real quick because, like you said, Dr. Woods, there's a thing in the United States called HIPAA, which in other countries there is not. And it was a culture shock when I went to the DR and I was working with Haitian patients because I do not speak Creole. And at one point I had a little 7-year-old little girl trying to translate with her 80-year-old grandma who had a ton of lists of just things that she wanted to get done. And I was asking, something for us so simple as like, does the liver hurt? Does the stomach hurt? And, or, just like certain concepts of like, can you rate pain from 0 out of 10? And I could not get anything translated. And I was frustrated with myself because I was like, darn it, I should have put a little bit more effort into Creole or something because I just could not get the info through. And so I know that the care that I provided the patient was not the best that it should have been had I known Creole and had I known a few words for it. And then I also wanted to say that family dynamics sometimes with like when patients bring their family members can get really tricky because in the Hispanic culture, for example, like the wife will go with the husband and like sometimes the patient confidentiality that you want to have with your patient gets compromised because the husband is there, because the wife is there, because the mom is there. And so the patient is not going to tell you exactly what happened or certain symptoms that would it would impact your care for the patient and the diagnosis of the patient. So family dynamic does play a lot in role into the kind of care you can give. And also once they leave the office, I've had this experience that one family member might get mad at the patient because why did you do that? Had you not done that, you would have not had the sickness in the first place. Sounds crazy, but it has happened. So I would like for physicians to know that even after the patient leaves the office, that diagnosis that they have told the patient and all that, it still affects family dynamics.
Yeah, it's really hard you spoke about the language, and I think children initially you were talking about that, Dr. Watts. For me, I remember, I don't know if any of you got to do this, but as a child, I translated for my grandmother, my mom, my dad going to the doctor. So that's just kind of what I did. But yeah, absolutely. So I have my translator hat, and I've had it all my life, right? Child, and that's what you do. You translate at the doctor the same way you translate at the bank or at the restaurant. And so it's not, I think the legal implications and the health risk is there. To see the other side, it's the trust and the bond that the patient has with this, right? My child or my mother or whoever it is. And it just makes sense. Or that's the only person that I know that will help me, right? And so I think there's a trust and there's that connection, and that's the rationale, right? To use family members as a translator, but it is difficult for in the healthcare setting.
I would like to chime in something real quick. I agree also with Carlos when he says it's very important that we all learn. I mean, in our case, we do, we're Hispanic, but with other classmates, Anglos, it will be good for them to learn the language, because there is this patient-physician relationship that once you're feeling that your physician is on your side and at least try to understand you, you are more likely to follow his direction than the physician that say, "What do you say? Can you repeat that again?" So that you feel judged to say, "Oh my gosh, I better don't go to the doctor, or at least until I absolutely have to." So it's basically building bridges, building trust with the patient, and trying to stick with the treatment. As Carlos said, you want the patient, for example, for blood pressure, to return and see how is it going after 2 or 3 weeks starting the medication. It's very important. But if you encounter a physician that you feel is judgmental or is going to scream at you because he don't understand you, then maybe you might not return. And then you have other problems.
Billy, that was a great transition. Sarah discussed. So how can healthcare providers and systems better address the unique health needs of the Hispanic Latino community?
I believe Carlos also has made a very interesting point of trying to include maybe some, I don't know, medical Spanish terminology, or at least try to make it, I don't know, maybe an elective or something like that in many medical schools. That would help, because you really want to get that elective done. And if you want to get it done, you have to get involved with it. Like we have, let's say, now in the block 6 and block 7, we have to go to different other areas, right? We have to get involved with groups, with volunteering. Why can't we do something like that with trying to learn that terminology in Spanish and maybe try to serve in some kind of fair, health fair, the Hispanic population in there, and practice what we're learning, obviously with the guidance of a licensed physician. Yeah.
That's excellent. I think also just being mindful of the signage that you use in the hospital or the clinic setting, and make sure it's very visible and providing some information. I was going to share, so I spent the day working on the East Alabama Health Mobile Clinic Bus, which is a partnership with VCOM-Auburn and Auburn University, and also East Alabama Medical Center, which is a local community hospital. And this mobile bus goes to different communities to provide screening. And about a year and a half ago, we are seeing an increase in the Hispanic community with diabetes, hypertension, young men and women having strokes, renal failure at the hospital. And we're like, we got to do something to provide some screening. And so we've begun to use that bus. And now we have nurse practitioners and physicians sometimes on the bus, able to also help with the screening process and can diagnose and treat patients. So I think that's one way, health systems can kind of tap into local colleges and community groups and things like that. And so if you're a physician working in an area and you're seeing there's a lot of patients coming in with diabetes or hypertension that are Hispanic, recognize that we probably need to be going out to do more screening and preventive care for this population. So again, that's just a way locally we've been able to kind of address this lack of access to care, is to tap into the bus and be actually in the community doing screening and getting them connected to the resources they need.
Absolutely. And I think a new way also, another way to, improve the healthcare providers and their systems, right, to address this health equity is the research, right? It's an upstream approach, but the idea would be to find the most effective ways, right? How can we best connect at the systems level and improve that? Yeah, some specific health conditions. I think I alluded to this a little bit at the beginning where we said, it's a good thing that we live longer. We actually have a higher life expectancy than other groups, and that's a good thing. But when we want to zoom in and talk about how where there's a disproportion, we want to think about diabetes rates, right? Significantly higher than any other group in terms of race and ethnicity. And the other one is just higher rates of obesity in general. And, why is that? And, of course, we talked about the culture and the food and how it's very much ingrained, right? When we talk about Latino culture is our food, and it's there. It's part of who we are. One of the things that is important to address when we talk about these health conditions and how they layer in, it's the fact that Latinos in the United States come from different parts of the world, right? Latin America, right? Central America, South America, and we have different stressors, right? And so the stressors that exist once Latinos come into the United States are different, or because for the very fact that they are away from home, right? The fact that they've been relocated and placed and essentially starting over from what they've known to be their home is a significant stressor. A stressor that, I don't know if it necessarily has been quantified, but you think about that and being able to absorb that, how is that translated over time, right? How does the body absorb that and translate it over time shows, right, after this 10-year, right, the Hispanic paradox, which I'm sure you're all familiar with, that after 10 years, the health of Hispanics essentially deteriorates. And it deteriorates for a lot of different reasons, right? The environment, the culture that exists in the United States is very, very different from the place where we're all from.
Well,
okay.
But how do immigration status and fear of deportation impact healthcare access for undocumented individuals? I saw you know.
I used to volunteer. I'm sorry, but that's a big one because I used to volunteer here at home. We have what is called a free clinic at the free pharmacy in San Vincent de Paul Society. And many of our people that came were Hispanic, but they were very fearful to give their real name, where they live, phone number that we can locate in them, because sometimes we might not have the medication that they need right away. We might get it the next day because we work through donations and we were well supplied, but sometimes we ran out of medication and they were very hesitant. They were saying, you will not give this any of information to anybody, right? You will not give this information in your database, and maybe I might see it, might come to my house. No, please. And they will get really stressed about that. And I used to be a pharmacist, so I volunteer in there. And I used to educate a lot of the medications. And I said, when we run out of the medications, you don't have to worry about we're calling ICE. We're not going to call ICE on you. We just want to get your phone number so we can get this medication to you. No, don't worry about it. Some of them will say, I can come back. I can come back later. Don't worry about it. When will you have the medication? Tomorrow, but I mean, what about if you're working? No, after work. What time do you guys close? This kind of thing. They just don't trust. They are scared.
Yeah. Mm-hmm. Absolutely. And that's what I was telling you about, the fear and the stress, along with all the other components of everyday life, that it takes a toll, right? On a person's body.
Alrighty. So moving on, what role do community health workers or promotores de salud play in reducing health disparities in Hispanic and Latino populations?
I can take on this one because after the research that I was mentioning earlier, the way a little bit of the basis was we would get together, get like the plan that we wanted to teach the promotoras, because we had the promotoras. We would teach them, we would train them, and then they would basically be your invoice into the communities. Then they would get along with the moms, text the moms, make a mom group, chef, and then get the kiddos together. And then they would perform the presentations or the education sides or ask the moms how they're doing. And I think they're very, very important, because as much as like us, like in the future, like me, myself, and Arlo, as much as we want to help out the community, we're going to be very busy physicians that we're going to be in clinic all day. And so having people like the promotoras who can be connected with the community, that can be our little eyes in there and let us know how it goes. Because sometimes we can lose like touch of like reality of what's actually going on in that community. And so having them allows for our target community to feel represented, but not necessarily attacked by us, you know, because sometimes when they see the doctors telling me to do this, I mean, yes, they know that doctors in the Hispanic community, doctors are very knowledgeable people, but they can also feel like they're dictating my life, or like they don't understand my struggles with my economic status or whatever it is. So promotoras are key, excellent. However, it takes time. It takes budget from funds from research. And it takes a lot of effort and willingness from the promotoras to do all this work. So, whenever you get a hold of them, you better.
Absolutely. I'll second that. And I'm working hard. We're working hard, right, Dr. Watts, to try to get other funding opportunities. And the goal is to try to get promotoras out here, because there's only so many healthcare providers. And that's one fantastic way to try to close some of that health education gap for our communities in need.
And even just helping our Hispanic community navigate the healthcare system. So you may see somebody in clinic and you want them to come back in a week. And even if you speak Spanish and you know, with them during the appointment, when they leave, they're going to have questions. And sometimes it's hard to get the right answers to those questions. So just helping them navigate the healthcare system, addressing their questions, again, because they may not have, like Sabrina talked about earlier, access to the right materials to get them good, solid evidence to support whatever it is that, you know, they have going on. So yeah, they're wonderful.
How can public health initiatives be tailored to better meet the needs of the Hispanic Latino community?
Yeah. So, you know, we've touched a little bit on some of these, but I don't know if we've directly addressed them. Public health initiatives, you know, I think I think about the differences between an urban and a rural setting, right? And we all know initiatives that can be fantastic. The problem is, how can we reach our vulnerable populations in a rural setting? Where can we find them? There's pockets. They're, you know, living in the shadows. How do we address them? And so these public health initiatives can exist in different ways in rural settings, through faith-based organizations, which are a fantastic source to connect, because that's a sense of community. You know, Millie talked about the fear of being at risk for legal status. And so a faith-based organization is a fantastic, safe environment where people gather, right? And so that's a fantastic way to do that. But those are locations, and those are things that we do here locally a lot of, right? And try to get those kids met. But initiatives themselves are things that, gosh, you know, Dr. Watts and I had, we just finished a 2-year PCORI-funded project where the whole point was to try to gain and work with the community of Hispanic women to engage them in research. And so, you know, sometimes you have to go very upstream, right? Very upstream, and try to think about how can we best improve the community? What kind of initiatives can we have? And the goal of the project was to essentially try to train, to some extent, our Hispanic women about what is research, how does that work? If there's one thing that we learned from COVID is, or the COVID vaccine, right, and hesitancy that existed in our rural settings, is that people didn't necessarily trust a public health professional or a physician telling them take the vaccine. And so it's important for our community, our Hispanic community, to understand the evidence, and, you know, having them educate in simple terms what does that mean? What does it mean when people say it is safe and effective? What does that mean? And so those kinds of initiatives are absolutely crucial for our Hispanic community. If there's one thing that I know is, yes, because we talked about that those comorbidities, people are sicker longer, right? And we also know that the giant, significant, glaring problem that our Latino community suffers from is the lack of education to close that gap. So, a lot of people will say, well, this is a lot of money and it's a lot of, investment and things. Well, actually, it doesn't take a lot of money to address the health education aspect. It is a lot of money when it's after the fact and there's millions of dollars invested in emergency hospital, and now the hospital's underwater because something they could have prevented 2 years ago. Now it's a terrible problem. They have to go to they're in kidney failure, or they have to go to dialysis, and you think about all the costs. So the initiatives on my perspective, thinking about low cost in a rural setting, a rural environment, is thinking about that health communication, health literacy in those pockets, which would be, effective, low budget, right, compared to the alternative could be, what it could be.
I think, Dr. Rodriguez, you touched upon it, like what policy changes or reforms would you advocate to reduce health disparities within our community? So you addressed the lack of education and how we should be advocating for more of rural and low-cost changes or reforms. Is there anybody else that has a different thought or would like to add on to that?
This is kind of the big picture. I'd love to see a better pathway to citizenship, or at least to be able to get a job, to obtain health insurance or Medicaid when needed. And so I think that's what I would really like to advocate and see changes in policies at the state level, so that and federal level, so that this community, if they have come here, that we have a pathway for them to have great outcomes while living in our country.
Right. Yeah, that would be, yes, absolutely. That would be fantastic. Absolutely. A lot of the problems is that they just don't have that access, and facilitating that would allow them to be integrated into society. This is so great, guys. This is great, just in time for Hispanic Heritage Month. And I'm happy they were highlighting our Latino culture, and you guys are very much advocates and a part of the community. And so I'm so happy, and thank you, Brittany, for allowing us to touch on some of these points today.
Wow, what an incredible conversation today. A huge thank you to our amazing guests for shedding light on the vital topic of disparity in Hispanic and Latino health. These perspectives for both our doctors and students were truly eye-opening. I'm your host, Brittany Lilla, and I hope you all are inspired as I am to keep these important discussions going. Be sure to tune in for our next episode. More great stories and insights are coming your way. Thanks for listening. Thank you for joining us on this episode of VCOM-Auburn Beyond the White Coat. We hope you found the insights and stories that we shared today both informative and inspiring. If you enjoyed this episode, please subscribe, rate, and leave a review. Don't forget to follow us on Facebook, YouTube, and our website for more updates and resources. Until next time, stay curious and keep exploring the fascinating world of healthcare.